I told you I was going to try it, and I'm not kidding. I am so excited for this. I'm joined this morning by Dr. James Wiley at Ute Pass Chiropractic, and we're going to work on core strength, which we all need, right?
Yes.
All right. What are we inside? This is fascinating.
Well, this is the AllCore360 that you're strapped into, and what we're inside of, this is a full spectrum infrared sauna. We just use the added therapy while we're doing core, so we get kind of 2 for 1. So.
Okay. All right, let's talk about the process of getting me in here. It was fast and painless, just so you know.
So basically, we want to make sure that the hips and the thighs are really secured, and we're secured in there so we can focus on just the core. And when we talk about core, it's from our chin down to our pelvis. It's all those muscles in a tube, basically around our torso. We use the ball to activate the muscles in the inner thigh, because when they integrate with the core, it helps with posture and the muscles in our spinal column. So anyway, we get you all set in. We talk about, all right, you're going to hold a good posture as the machine basically starts to tilt back, engages your core, and then you basically do a 360-degree plank while you're in the sauna.
Okay, I just want to say right now, I do feel engaged on the bottom half of my body into my pelvic floor. And I'm trying to hold my posture. I've been told not to put my elbows down here and not to lean all the way back. So that's my focus now.
Yeah.
And then I guess, Doc, whenever you're ready.
When you're ready.
I think we can do it.
Okay.
Okay, and as I'm spinning, I want you to talk about the uniqueness of this and how you can't find it anywhere else, really, in our community. Okay?
So here we go.
All right.
So as this goes back, you should start to feel the front muscles start to engage.
Okay.
Try to keep your chin up a little bit.
Okay.
It's going to start to rotate. As that starts to rotate, you're going to start to feel the transition from this part of the front to the sides.
Okay.
As it rotates around, we're starting to engage the muscles in the lateral side, which sometimes are harder to do when we do core workouts. This is the way you feel those fully engage. On the side?
Yes, I almost started shaking immediately, and then I've been able to kind of refocus, and I feel like I'm in a good place now. I do feel all my core being engaged, and I'm really focusing on lifting my chin up.
And keep the back of your head up too.
Okay.
There you go.
Okay.
And so the shaking, that's just the muscles learning to activate, because you're activating fibers.
Okay.
Let's tilt that way a little bit. You're activating fibers that typically don't get activated when we do exercises.
Okay.
So as that comes back around, really focus on keeping your head straight there.
Okay.
You should start to feel that front side engage even more.
A little bit of a shake there.
A little bit of shaking.
And that's okay. And I'm not in pain. I'm just
going
working.
back a little further.
Okay. A little bit of shake there.
And it's so we change the angle as it's going around again. And you feel, again, a little more of that engagement. Now, sometimes what we would have this do is you would rotate clockwise and counterclockwise. So we work that balance at different angles. Now, once we figure out the angle, then we start working on that, on building that balance, and then really working on the strength. What's unique about this machine is you get full engagement of all of your core simultaneously in one session. So a 10-minute session is like doing 2 to 3 hours of planks. And so...
Okay, I want to know how often you would suggest somebody would start this treatment plan.
I think based on an assessment that we do at the beginning, we would want to make sure that the patient can do exercise, number one, but then we want to go about 3 times a week for about 6 weeks as kind of an initial introductory program. And then I think you're done.
I did it. Yay!
This might spin again. Let me
stop if it spins, I'm good.
Let me stop it.
Okay.
Oh, we're done.
Okay.
That's not a full session.
Right. This is a very shortened session because of time. Yeah. But I feel like I worked my core really well, and that was only 2 spins.
Yeah.
Okay.
Do you feel the difference in that?
Well, I felt like I was really engaged and I was able to focus. I wasn't in pain. I just felt like I was getting some really great work in, some really focused work. And I get sloppy when I do core work, let's face it. You know what I mean? I don't know that I'm in the right position. I think one side's stronger than the other, and I think this really keeps everything in line.
And that's what we talk about, core balance. So we work on balancing the core before we really work on increasing that strength. Because if you don't have the balance, you're going to have things that will come up that might create more injury or something like that.
In the big picture, why is core strength so vital?
Well, the core is what it's our midline. So when we lose that core strength, we lose, like in elderly, we lose our balance. So core is vital. It keeps our hips lined up better. So it prevents extremity injuries, and so we can rehab a lot of things. In people that say they've had a knee replaced recently, they can't get on the floor and do certain things. I can exercise your core if you're recovering from a shoulder injury or something like that, or you have a back injury. There's a foundation in Georgia that actually does brain trauma and stroke injury, and this is how they rehab them.
I'm going to be honest, Doc. I actually had fun. I actually really liked it so much, so I want to do it again, and I want to do the whole 10-minute treatment to see what it feels like. I'm not kidding. I really loved it. I think everyone should give it a try. I really do. It's such a unique way to work the core with such an expert help. So thank you so much. But we're not done here at UPass Chiropractic. We've got more. I'm going to cool off a little bit. I did get sweaty, and we'll have more with you coming up in a little bit. But for now, check out their website, woodlandparkdoctor.com.
Jennifer.
Yes.
Did you feel it? Did you feel it in the core?
I did, and I felt it the next day too.
Really?
Yes. I can't imagine how much progress I would make if I was going consistently for 10 minutes a day.
Well, he said it's equivalent of 2 to 3 hours of planking.
Yeah. It was hard. Don't get me wrong.
I could tell you your concentration face was amazing. You didn't even drop the cue card.
Yeah,
Pretty impressive.
I was holding on to that. It was like my comfort cue card. Yeah.
Amazing. Well, this segment has been sponsored by UPass Chiropractic for We Are Woodland Park.